So the Delta variant now accounts for 83% of new COVID cases in the United States. Here to answer your questions about that and so much more, Dr. Todd Ellerin, as you know, Chief of Infectious Diseases at South Shore Health. Doctor, thank you for joining us. 3 weeks ago, the CDC said Delta was causing about half of all the cases nationally. So a jump to 83%, that is a sharp increase. So how does it change the risk right now to people who are not vaccinated?
Well, Maria, yes, it's the majority of cases right now, and cases have climbed. Yesterday, there were 55,000 cases in the United States. There were 600 deaths. That's numbers that are going in the wrong direction, and they're going in the wrong direction in Massachusetts as well. So I think more and more, we just have to double down against the virus, full court press, and that means trying to vaccinate as many people as possible. It's not too late. I would ask people who haven't been vaccinated yet to try to accept trust over mistrust and to know that this vaccine really can be life-saving.
Dr. T, we're hearing an awful lot more about these rare breakthrough infections, especially locally in places, for example, as we were reporting, like Provincetown. So does that mean the health risk for vaccinated people is increasing as well?
Well, what we know, Eddie, about this variant is that it is more contagious, and we know that the vaccines do have reduced effectiveness against infection. So you can get that virus in the back of your nose. You can transmit it to other people, but if you're fully vaccinated, that risk is much less of transmission. But the good news is you're less likely to get hospitalized, you're less likely to get severely ill, you're less likely to die. So we are hearing more cases. We expect to see that, but hopefully most of those will not end up in the hospital.
I think a lot of people believed, doctor, and they hoped you get the vaccine, we get back to normal, there are no masks, the stay-at-home orders are lifted, there are no travel restrictions. You know, it felt good. You think, okay, good, here we go. We've turned this corner, but normal, is it further away now? Are you still confident we can get there?
I mean, I do think we can get there, Maria. You're right. You know, we're not back to normal. I didn't think we would be. You know, some of the, the recent occurrences, it's discouraging. But the one thing I'll say is, remember, kids are going back into the classroom. Yes, they may be going back into the classroom with masks, maybe both the vaccinated and unvaccinated, but I think the classrooms are open, right? So we may be masking more indoors, but hopefully the restaurants and the gyms and everywhere else will be open as well. So I think things are better. I do feel the worst is behind us. But with that said, we have to be realistic. We've seen it in Israel, we've seen it in the UK, and now the US. The Delta variant is that contagious, and we're seeing the effects right now.
I'm just curious, Dr. T, because you've been on the front line of this pandemic since day one. So what has it been like for you personally to see these case numbers rising again? And to be honest with you, having talked to you for so long, I can hear a little concern in your voice as I'm listening to you.
Deep sigh, Ed. So what I need personally is more yoga, more of that deep, controlled breathing. It's definitely, look, I wanted cases to go to zero in the United States and Massachusetts and stay there. We talked before, you've heard me talk about the cat and mouse game.
Right.
That's sort of what we're seeing here. We're getting people vaccinated, but the virus is shape-shifting. And, for me, I think the key is it just makes me just want to urge people to please, when you have that molecular shield that can protect against the virus, when that half the country still isn't vaccinated, almost 30% of adults in the United States still aren't vaccinated, it just makes me want to help them, and I don't exactly know how to do it at this point.
Dr. T, thanks for your time.
Thank you, Dr. Ellerin. Be well.
You too.